there. So as I said, why, how do we do all this? How this data gets transferred? So as you know, financial system, I'll again, because I think it's all of us are slightly aware of the financial system. Uh, in the financial system, uh, we all know whom we have to transferring the account. So every bank has a UI, has a customer ID, and now we also can transfer money through Aadhaar. So similarly, instead of going the, we have a ABHA health account number. So Ayushman Bharat health account. So if I give this number will stay in various systems. So this can be a unique identifier. So Narendra Singh in AIMS will have one number which AIMS will give. AIMS Delhi will give me, but this number can, if I transfer it to NCD program, the NCD program will know. They need not know Narendra Singh, date of birth, the son of this, and all those things need not be used. They can only use ABHA number to match. Health professionals, any health professional, a doctor or a nurse, he can be identified. And HFR is the identity given to the facility. In a banking system, every bank has an IFSC code. So similar to that, we have an HFR. HPR and HFR are also important. They help us in other things also. This will help us in knowing how many actual health professionals are there in the country. In future, if I want to verify whether the doctor, whoever, or nurse who is claiming them to be, we can put in their HFR number and get whether they are the, you can do it with NMC also, but then every state has its own council, everything. So this will be one single source for everyone. HFR, during COVID times, all of us realize in the bank, in the health system, that it's very difficult to know exactly how many, how many. I mean, it is not available at one single shot. So this thing will be available, the facilities which are provided there, whether they have ventilator, whether they have oxygen mask, how many beds are there. All that information will be there in HFR. Again, it's all voluntary. So we have got around 80 crore ABHA numbers, around 7 lakh doctors and nurses. This number is more than 30-40 lakhs altogether. We are still a long way to go. And similarly with the health facilities. And this is both for private and public. So I think one important thing which we have HCX and UHI also, but in a government parlance, what is more, what would be more interesting to you would be called interoperability health data exchange. See, when we say exchange, the data which is residing in one system, if it is accessible by any other system, like RCH can access the data of Poshan program, which is the Anganwadi workers, because Anganwadi worker, she goes, she takes, she is supposed to contact all the pregnant ladies. Then they will have a data about the pregnant ladies. But RCH program, if you just don't go and register yourself, then but because Anganwadi workers go to each and every place, they should get it registered first. Then they will come to RCH. Or similarly, Asha and Anganwadi workers, they all hold together the VHS Hindi Day. So they are also, but both systems have the separate data. They take height and weight every month in the portion program it's supposed to take. But so it can be accessed. NCD program, you're doing screening. But suppose, before screening also, if a beneficiary is coming and you get their earlier data when they are to a government hospital, you would know actually they are actually a diabetic patient or a BP patient. So you don't need to do a complete screening for them. You can just use it as a current data and see whether they are taking all those medicines which are required, which government provides. So that's where the health information exchange will help us. And for the people who are academically inclined, it will help us in uh, because it can be used as a single source repository based on the consent. So you can do disease surveillance or even if it's two different, tell us. Suppose there is a Nikshay program, which is a TB program. There is an NCD and an RCH. We know, how many beneficiaries are there in all these programs in a particular area. How many people are currently in the TB program, and how many people are NCD and or any other pregnant lady. So if there's a too much concentration, it can be checked. Health claims exchange, it is not so much, applicable to mostly to the government people here. But if you have an insurance, private insurance, then it is much more. I mean, you can see the benefit of that in the insurance company. When if you, even if you are told on the last day that you can go home, it takes around 5 to 6 hours before the insurance claims and process. So with NSCX, we are trying to bring it down to maximum 1 hour. That will be the time. So hospital is also benefit because the bed is getting clear and the patient can also go home faster. So this is the diagrammatical, visualization of what ABDM is actually do. See, if you, some of you are, technologically, you would think about it. If you wanted data from one government program to the other, they will have to be connected on their own. Uh, yeah, again, suppose banking system. When ICICI Bank, one money was to be transferred within the branch of ICICI because they are all interconnected through the ICICI common network. But if money was to be transferred from ICICI to SBI or ICICI to PNB to any other bank, either they will connect directly to PNB or through now we know NACH switch is there or an exchange. Now, if you want to exchange is also applicable. If you're talking to a person who is having an Airtel or is having any other mobile system, how do you do it? You just you don't. They are not connected. They go through an exchange. What we had in the olden days. So ABDM is also like that. Everyone is connecting to ABDM, and they can all data can transfer from one system, one database to the other database based on the consent. Important thing is consent. The patient needs to say yes that I want to share my data. Only then it will go. It is not that if I know the ABHA number, I can get information about person and whatever the health data from any other system. So this was basically setting the context of what ABDM is. But how is it useful? See, we would see. We all know long up. You are dealing with and you are here in the healthcare business. You know the health history is something which is very important for anyone. We may not know as normal person, but people who are in the health ecosystem, they know. Even if someone tells me I had a problem 10 years back, it may impact me still. So health history, what is the medicines which I have taken in the past, they are important for the treatment or for any patient, any person, and the kind of mm, government programs that we have, maternal program RCH or TB or disease service program or even in NCD. So we are dealing with with all these programs are interconnected. A lady who gets pregnant and if she had a TB sometime back, the patient may not even tell the doctor, but because the longitudinal health history is available to the doctor, they can make a better decision. Uh, Similarly with NCD, if you chronic once you see this, you are screening someone today, but if the patient was actually taking that medicine for last 1 year, they may or they may not tell. But if you get the information about from their from the state government program or wherever hospital they had gone, you can help them in a much better way because every medicine even in case of sugar, the efficacy of medicine, if the medicine is useful for last 1 year, and if you see the trend pattern, which you will not be able to see if they come for screening to you today, uh, you'll give them a different medicine. So that is why health history becomes important and health history from multiple sources. That is something which you are able to get using ABHA. As I said, these are the key benefits which we perceive as people actually in the business of providing health services. You would may know it much better. medical errors are prevented, because if I know that the person is taking this drug, whether the adverse effect drug is being administered to him or her, you would come to know if you know that the person has taken this drug in last 6 months. See, I mean, I am talking as a normal person. I'm not a medical professional. So when I go to a doctor, I know, don't even half the time we don't even know that something which I had taken 6 months back, a medicine may impact the current situation. So you don't even tell them on this medicine, I'm on that medicine. I mean, I don't know, many of the elderly people, they if they go to the doctor, three different doctors would be giving them vitamin. So they have an overdose of vitamin medicines with them. So this is all important to us that I mean that's where ABHA will come into play. It will provide information on this. It can also help in early detection of diseases. So you would be dealing with patients and your beneficiaries. So they would say, okay, I am giving you my Aadhaar to get an ABHA created. So in your government system, you will know. But how do they know? Is it, see, as a patient, they should also know where their records are. What is the advantage they have giving this? It's not that government is only getting this. So what we have got is we have an app. We all are, very familiar with this word app nowadays. We have the apps where for payment, we have apps for multiple things. So similar kind of thing. There's an app which is called ABHA app, which is for personal health record. You can have your just as you have a personal finance in Paytm or Bheem, similarly or PhonePe. Similarly, we have a personal health record app. If I go to a doctor, if I go to a NCD program, if I go to RCH, if I go to Nikshay, I can create a digital record, and then record is available to me on my phone. So today on Bheem app, I can see my balance of ICICI and SBI on one single app. So similarly, on this app, I will get the prescription or the record which is kept in any of these systems on my phone. So as a patient, I don't need not keep a file of all my prescriptions. So as I said, this is where say link health records. If I have something on a piece of paper, I can scan it and upload it. I can link it. I can see my which is in the system. Nowadays, recently with the ABHA app, we have done a scan and share. So if I go to a government hospital, they do an OPD registration in an electronic way. But in the OPD registration, there is a big queue. So to prevent that, we are doing a scan and share. You can scan the QR code of the facility, just like as you scan for payment, and you send your personal details. So in the system, my name, age, gender, address is all there. So if I have to spend 5 minutes telling that person there, just imagine you are the 10th person in the queue. So everyone takes 5 minutes. So your number will come after 45 minutes. But with this, it's only 20 to 30 seconds. Even if you take 1 minute at the best, so your number will come after 9 minutes. So you are not standing in the queue. So advantage is standing in a queue is will be felt only when you have pain in your, if you have fever, then you don't like standing in a queue. So that's where it is. So I can say manage consent. As I said, how information will flow, someone has to give okay. Right now, also many of you may have seen sometimes you get request, payment request. Please approve the payment request which has come for that. Similar kind of consent we will give for sharing. This is for one person. You can see Himanshu Barad. He went to AIMS Delhi, and he also went to uh, different hospital in Patna city. So AIMS Delhi and Patna city are two different systems, and they are there the records are there. So I think ABHA, as Pankaj was talking in the beginning, it's a identify. It's not an identifier. It is a account number, because identity is already there by Aadhaar. So using Aadhaar, we have created an ABHA for them. So ABHA can be used. You will have NCD ID, RCH ID, Anganwadi Poshan ID. You go to a hospital, they will have their own ID. And But to have to know Narendra Singh across the system, ABHA can be used. This will also help, exchange of information. As I said, NCD program can access information which is there in any government, government hospital system, e-Shashwat, e-hospital, or even in the private system. Whatever is there, whatever prescription is there, you can request and you can get it based on the consent. So if I if I am detected as a patient and I have to take medicine every day, so you can see the whole history, future history, and past history, and do the continuum, provide that medicines to that person. One is that double dipping. It doesn't mean it is mostly comes into the context of not every program has it, but I will need not get the same medicine if it is provided free of cost through various programs. I don't use it. I can, I will have, I can be identified that got this medicine from the other system that day. So you can provide it to other people. The government resources are not, unnecessarily misused. Deduplication of beneficiaries, it will help. NCD has done a phenomenal work, I think, in the last I think more than 1 year, they have been integrated in the system. Here, I think we 7 crore ABHAs you have created. I think number of linked ABHAs are much more in the NCD program because ABHA can be created only once. It is one person has only one ABHA. So if the ABHA was created in the RCH program, you will get that information. So, but NCD has created totally new ABHAs to the context of 7 lakhs, 7 crore. So I think out of 80 crore, it's a good contribution of NCD program. Uh, all of you who are in the program, I think you should take pride in that you have contributed in a big way. Apart from your normal work, you have contributed in a big way to this ABDM. The health record which are linked is the linked records related to these ABHAs or old ABHAs. And M3 is a program, as I said, you can get the record. So this M1 and 3 is 3 milestones. Your technology system will have 3 milestones. So earlier you were able to create ABHAs, you whatever digital, whatever record, screening which you do on piece of paper, and then you put it into the system. It gets linked to those ABHAs. So 15 crore have been linked there. And your system will also have technical capability. So if a person comes to you, gives their ABHA, and they have gone to any other system, you can get the information from any other system. This is what we call M3. So I think Pankaj would later on. Pankaj, you should arrange for the session for a field workers how to fetch the records in the system. So
Yes,
that
sir. Sure will do it, sir. Sure. Thank you.
so this is the these are the various stages. As a program, you are in this program, your system is already integrated. But if as field level workers, if you are also on, responsible for other programs, you or at any state level IT program is there, and you can, and they are not integrated with ABDM, they are not using ABA. You can tell them these are the various stages. It is a very simple program. We are talking to every state government program, whichever is health related, to register and get it. It takes 2 to 3 months to do it if you do in a dedicated way. So, and this is a screen which shows, it is not exhaustive. All the government solutions, e-Sanjeevani, e-Sushruti, e-Edge, and we are also DigiLocker is also integrated. So as you know, DigiLocker you use to upload your any other document. So DigiLocker is also acting as a health record. So if you have your health reports which a doctor still wants to see if it is very old, but you have it may be going out of paper kharab, paper is getting destroyed. So you can take a copy and you can upload it there. See, currently, if you take a copy and you keep it on your phone, but you lose your phone, you lose the picture. But in the DigiLocker, you can upload it, and now it is kept as a separate as a health locker. So the doctor may be able to fetch it even if you're not carrying your phone. It is not limited to only existence on your phone right now. Government programs, RCH, Nikshay, no Poshan, all these are integrated. Even you, on the private side, if you go to Lal Path Lab, you get yourself tested. See, I'm not talking as an NCD program, as a normal citizen also. Uh, you, God forbid, you should have a problem, but if you have a problem and your records are there, you can get it. So if you go to Lal Path, you're getting tested. Re- It is not only available on SMS and the link which you click on that day, it is available 1 year later down the line on your app. I can bet you if you click on the Lal Path Labs link today, if for a test done 6 months ago, you'll not be able to fetch the report today. So these are the things which are available, and come an end to this my presentation. So Pankaj, how does it happen from there? And
Thank you so much, sir, for a wonderful insight-based today's session, sir. So we have a Q&A round also, sir, in this webinar, question and answer. So we have few questions from the state, sir. As the today's topic is very important, everyone want to understand how we can able to leverage the ABDM into the NCD management. So, sir, we have a first question from the state. How ABDM NCD integration helps in the non-communicable disease management? So how this uh, integration helping us in a non-communicable diseases management?
as I told you, so disease management is one thing which you are doing as a program, but suppose this information available in other systems. So you, for a person who's coming to you, you don't want, you are not aware that they have gone to any other hospital. So, but they are a chronic, they may be a disease, that person may have it same disease for a long time, but it is something which is a problem with us. When we go to a doctor, we don't tell them. Or if a government program is there, you don't tell them that I have this problem for last 2 years. But if it is in the medical record anywhere, you will be able to get it, and you will be able to take a better decision. So that's where anyone suffering from blood pressure, which is, BP problem, which is come only last 1 month, or it is a thing where it's a chronic disease for last 4 5 years, you will have a different treatment plan. So that's where it will help.
Okay, sir. Rightly said, sir. As we have a long
Pankaji, we have lost your voice. I think you have some bandwidth issue.
longitudinal health records with us now, so we can practices. Thank you so much, sir. The next is I'm audible now, Abdesh ji?
Yeah, audible. Could you please repeat? Because we have lost your voice between that.
Okay, is I'm audible now?
Yeah, audible.
Yes.
Please continue.
Okay, so I was thanking Narendra sir for answering the first question. So the next question is also related to the same. The how ABHA is strengthening the NPNCD program monitoring. So sir, this is about monitoring. How ABHA is strengthening the NPNCD program monitoring.
See, monitoring is something which is related to your this thing. What it helps you is identify the beneficiaries. We would also, currently in the NCD program is not facility wise record linking is not there. If it was there, you'd actually, actually identify how many people are coming in that each facility. See, one thing which is there for any government program, then counting, coming to a number which is the correct number in terms of beneficiaries. Of same person is counted multiple times in multiple facilities. That way, it doesn't help. So that way, exact number of beneficiaries, exact all those things, an ABHA will help, and you need not use the Aadhaar to identify a person. Once ABHA is there, it is one person, one ABHA.
Okay, thank you, sir. The last question of today's webinar is, sir, state wants to understand, sir, the benefits of ABHA for people living with NCDs. So this is direct beneficiaries benefits, sir. How people living with NCDs have the benefits of ABHA?
As I said, see, in the end, ABHA is not something which will give you any benefit. It's not something which is a benefit. It is a ABDM program which is helping you. Okay, ABDM is an ecosystem. Uh, how ABDM is helping? When we say chronic problems, when we say any other thing, if I go to a doctor, see, the doctor wants my, suppose I have, if someone has sugar, the doctor wants to see my 6 months records. So what do? You carry with you a file. If I give my from personal experience. My wife was pregnant and we had some other problem earlier. Undergoing treatment. She had to, so we had to carry records for last 2 to 3 years every time. So we had 3 bags. I mean, two small bags. There would be 3 files. We'll carry every time. And I had to carry that even when my son was born after 1 year. I mean 1 month. We may not know what the doctor may want. And similarly with any chronic disease, if the doctor wants to see what happened, last year, were you responding to this medicine last year or not? They would they would like to see the old records, but either you carry with them or they have it in their system, or if you go to a new doctor, it is not there. So with ABDM as a whole, it will take away the burden of carrying all those records in your the file, or in the Hindi hinterland we have something called a jhola. Jhola is a small bag, so we are ABDM will take carrying a jhola every time.
Thank you, sir. Rightly said, sir, that any people who are maybe having any disease, so the benefit of ABDM or ABHA, that they can access their health records and they can able to know. So thank you so much, sir, for joining the webinar. So this is a time for closing remarks and for thanking all the participants. So I should thank all the participants who joined today's webinar. We would also like to thank you, Narendra sir, for the informative session today. And we also want to thank all the participants who state nodal officers who joined today's webinar. We also like to thank Dr. Sasti Charan sir, DDG NCD MHFW, who has initiated this webinar, National NCD webinar series. We also like to thank Dr. Avinash, DADG NCD MHFW. We also like to thank Dr. Tushar, ADG NCD. We also like to thank Dr. Shalini, NCD team in the MHFW. And we also like to thank ECO team for supporting NCD webinar series since it's been started. Thank you very much, sir, for joining this wonderful session and your valuable insight. I totally believe the state NCD team has benefited with this insights. And सर मुझे पूरा भरोसा है कि हमारे एनसीडी टीम को आज काफी उनके जो डाउट्स हैं वो क्वेश्चन से क्लियर हुए होंगे and thank you so much, sir, for joining. Thank you so much, sir.
Thank you for calling me.
Thank you, sir.